Great, good morning. Great to be here. We love Philly, hence the beautiful picture of Philly. So the Center for Active Design, just to kind of introduce you to the organization, we were born out of the end of the Bloomberg administration. We just said we're playing Bloomberg bingo this morning. So we're based in New York City, but at this point, the subject of how the built environment impacts health has really gone global. And we work now in 35 countries. So this has really expanded. And what we've seen over the last 10 years, so it is 10 years ago that the active design guidelines were published during the Bloomberg administration. And that was really the first time that me, as a recovering real estate developer, had really had an idea that what I was doing in the way that I built buildings, as architects designed buildings, was actually impacting health. This turns 10 in 2020, the active design guidelines. So what we're really looking at is what has happened in the last 10 years. And so this is going to be the story, a little bit of that. So this kind of spans 10 years of the Center for Active Design's work. So we started off, I was the director of active design at the end of the Bloomberg administration. Active design was really looking at physical activity. How can your built environment encourage physical activity? Since then, we've really expanded, as the evidence base has expanded, we've expanded to really look at holistic health, so physical, mental, and social health. How does the way we design, maintain, and operate our buildings and our neighborhoods impact all of those kind of health outcomes? We've worked very much with the real estate community, so the Building Healthy Places is a publication that we worked on with the Urban Land Institute, who have 35,000 real estate developers as their members. It's a fun party. FitWell, which is a building certification kind of modeled on LEED, but really looking at how do we take all of this evidence base and make it into a standard that can then be used at scale across the world and really set a standard for what is, how do we define a healthy building. FitWell was actually created by the Center for Disease Control and Prevention while Dr. Frieden was heading it up, so it's all a very small world. We operate FitWell at this point. And then Assembly, which is the latest publication that we put out, which is really kind of expanding public health into civic life. So trust, participation in public life, a sense of agency. What aspects of those kind of behavior and attitudinal changes are impacted by our built environment? So this is kind of our path, and I think it's also the path of research in the built environment as well. So what I'm going to talk about, I was a developer. I can't really say I am a developer anymore. So I'm going to talk about what is going on out there that suddenly every developer you talk to wants to know about health. Like, why has that happened? And there's a few things that we've seen over the last 10 years. When we were working on active design in the beginning, it was really a top-down approach. We were saying, we see the evidence base, we understand that by changing the built environment in these ways, it is going to impact health in a measurable way. The individuals of the public, the Post, for instance, the newspaper in New York, thought that it was a nanny state and we were imposing these ideas on people. There was no demand from individuals. There was really no connection from individuals that there was really a measurable impact coming from where they lived and where they work, and that the design of those places was really impacting their health. That has shifted completely in the last decade. So we are now seeing great stats. We all love data. 78% of the millennial generation in the workforce in the US today are demanding that their workplaces be health promoting. This is a tight labor market. Retention and attraction of staff is pretty much the driving force behind why our employers are now looking at how do I create and provide my employees with a healthy environment. So we've got individual demand, and there's a similarly strong demand on the residential side. We also have a perfect storm, so we've got individuals demanding it, and we have the investment community globally looking for investment opportunities in businesses that are reaching environmental, social, and governance goals. And we, as folks who promote health, fit that S. So ESG, social, is where we are playing. So you've got an incredible amount of money globally from pension plans, sovereign wealth funds, institutional investors, who, because of their individual investors, again, the millennial generation, as they start to invest in their pensions, they're saying, you need to be investing in companies that are meeting environmental, social, and governance goals. This money is estimated to be $20 trillion over the next 2 decades. That has got the attention of every real estate developer that I'm aware of. So this is driving it. So you have a perfect storm. We have everybody's attention. My favorite quote of 2017, this holds true now, that health is now an investable attribute of real estate. You have now defined what a healthy building is. You can now start to compete across buildings. Buildings are using health as a way to differentiate themselves. Companies are using health as a way to differentiate themselves for all of those investment dollars. This is a really exciting time for us because now we really need to answer the question, tell me what to do. Like, we have everyone's attention. It's very exciting to see this because we've been jumping up and down for the last 10 years trying to get everyone's attention. It leads to very strange bedfellows. It leads to very strange partnerships and exciting partnerships. So we have partnered with Fannie Mae. I don't think they need any introduction. So Fannie Mae, they control half of the mortgages in this country, as well as a lot of the development loans as well. Fannie has created healthy housing rewards that we helped them create. We created the metrics and so on. They created, obviously, the loan program. So they are now providing affordable housing developers with a 15 basis point reduction on their loans if they are FitWell certified. So you've now made a connection between Fannie Mae and their underwriting and health promoting strategies. This is very exciting. This is a really big shift, not just because it actually provides a financial incentive for affordable housing developers to promote health, but also it signals the market that this is real. Fannie are not an easy organization to work with in that they require huge amounts of data. You need to be able to demonstrate that this is actually going to have an impact. Otherwise, they can't get it through their regulators until yesterday, where I believe they don't have regulators anymore. Anyway, so Fannie is an exciting move forward, and we're seeing this more and more now that other financial institutions are interested in this. So what is this? I'm just going to talk about this a little bit, but you guys all kind of know this part of the story, so I wanted to concentrate on the market forces. So we're really talking about holistic health. The physical activity piece, I feel like people know from active design. It's really about, like, how do you present a stair when you first walk into a building? You're far more likely for someone to actually take that stair. This is new to real estate developers. They don't know this until you first present it, and it's exciting to them that they can be part of that solution. The mental health and social cohesion is even newer and maybe somewhat new to you guys, but really there's a massive connection between access to nature, preservation of community context, all of these things, lighting, perceptions of safety, all of these things impact mental health and social cohesion in a measurable way. All of this has academic research behind it. These are some of the ways that the built environment is impacting mental and social health. So some of the kind of the strongest connections, this is a real little moment to give you a peek into this, but connections to nature have a very strong impact on mental health outcomes, social cohesion, social interaction, all of those things that are really impacting overall life expectancy and health outcomes. So if I kind of were to do anything, I would say, let's really look at how can we green our cities, our buildings, interior and exterior, because it's having such an impact on overall health outcomes in all contexts. Another thing that's very important as well, the perception of safety. Safety is particularly important when it comes to older adults, so it's definitely an equity issue. But really understanding the role that lighting plays in perceptions of safety is something that we now know and can really use this to actually create actionable strategies. Tom kind of talked about what are the solutions, and this is kind of the business that we're in, providing those who are making the decisions, whether it's public or private sector, about our built environment. We've expanded this work into the civic design as well. So we're really looking at how does design impact trust and appreciation, participation in public life. How do we ensure that people are stewards of the public realm? What is it about the cues in your built environment that either make you drop that litter or pick it up? And so it's very interesting that your public spaces can actually make a difference there. And finally, local voting. This is really more of a sense of agency. What about your built environment impacts levels of agency? A deteriorated public realm has impacts on overall health outcomes, but also crime, safety, economic outcomes, opportunity. All of these things are impacted by a deteriorated public realm. Litter is a particular issue. You can see here we did some original research, and this was actually very much driven by Philadelphia and the Fairmont Parks Department. If you are in a community that has a lot of litter, you're seeing a minus 10% impact on community pride and trust in government, and a minus 5% impact on the trust in police. So there's a direct correlation between trust in police and levels of trash in your neighborhood, which is fascinating to kind of be able to put numbers on that. Conversely, a well-maintained public realm is having very positive impacts on all aspects of quality of life outcomes. So this is definitely an equity issue. It's also an economic development issue. It's exciting to be able to join the dots at this point. And something that's just so simple, something like having public seating has an impact on trust and participation. It also has an impact on satisfaction with police. And then we also know from the public health research that having benches actually encourages people to walk because they believe that they'll be able to sit along the way. So it had many different things that are impacted by these very simple strategies. But that doesn't mean that they aren't impactful. I think that one of the problems with what we're talking about is it's not rocket science. This stuff is so obvious, and yet it is still impactful. We really need to be able to continue to make that connection. So I'm just going to finally talk about FitWell. So what FitWell has done, the CDC created FitWell. 3 years ago now, we were given the license to operate FitWell. And what it did was it's taken this massive global body of evidence coming from public health and translated it into practical design and operational strategies for workplaces, for residential buildings, and we've now expanded it into a community scale as well. At this point, there are 5,600 peer-reviewed research studies that are supporting FitWell, and actually meaning that each of the strategies within FitWell can actually be weighted. So we can start to say, this strategy is going to have a greater impact on health than another strategy. So you can really start to set priorities, and you can really understand how strategies impact these specific issues in health. So if you're in a community where you know that there is an issue around mental health outcomes, or you have a particularly high levels of deteriorated trust in communities, you can really kind of use these strategies to impact those outcomes specifically. It's really been a game changer. It's allowed us to scale our work. We're working in 35 countries using FitWell, and we've really seen incredible market traction from the real estate developers who are really beginning to use FitWell at scale now. So this is the kind of traction that we could never have imagined at the beginning of this journey. The community standard is really exciting. It really brings together kind of the two sides of our work. It brings together FitWell, which is really this kind of delivery system that we can now use to scale this work so everyone has access to all of this incredible public health research in a way that is directly relevant to what they are doing, which is designing and building buildings. The community scale brings all of our work in assembly and the neighborhood scale public health research together with FitWell, and is basically kind of expanding the conversation to community scale developers and obviously to cities as well. This is in pilot phase. We have one city, the city of Vancouver, Washington, that's using it, and the rest are private developers from around the world, including Australia. So it's exciting to see that there is a real appetite for this knowledge and for these solutions. It's really touching on everything. It's not just touching on kind of how do we build a building. It's really looking at where are we building our communities? What are the underlying impacts of that kind of decision about siting? Is it a brownfield site? Is it downwind of some kind of pollutant? What is the access to transportation? What is the food environment like within this location? How can we optimize that? It's looking at community assets and how can we hire locally. It's really looking at a very holistic impact on the local population, on the community at large, and it's all based on the evidence base. So these strategies are the strategies that have the strongest evidence base with the greatest measurable impact on health. A call to action I would make to you guys is that although we've come so far, there is still so much more that we need from the research community. And one of our great fears, and something that we're going to guard against, is really two things. One is an equity issue. It's really easy to make a market-driven argument as to why you should promote health. You can then sell your apartments for more, you can hire people, etc. It's very important to us that we keep our eye on the affordable housing sector and we ensure that they are brought along as well so we don't have an even greater gulf. So that's one thing I would say. The other part is that one size does not fit all. So we would hate for someone to say, oh, here is a project that has reached this highest level. I am now going to replicate it over here in this other community, because that will not work. So how do we really start to articulate that every solution needs to be unique, it needs to be uniquely suited to the community, to the geography, to the climate, to the existing history and context of that environment. So this is kind of the challenge I would say to you, is like, how do we continue to articulate that you need to celebrate individual community identity as we go forward and create places for people to live? Just finishing by showing off a little, this is what we've done in 2 years with FitWell. So we're already impacting over 600,000 people, and this is growing on a daily basis. So thank you all.